So lots of our patients have a fear of needles, and that's not surprising. No one likes having a needle stuck into them if they don't have to. There's some very simple ways of decreasing the pain of an injection. What I find most effective is stretching the skin. If you try to push a needle into soft, floppy skin, it hurts a lot more than skin under tension. So stretching the skin first before you insert the needle makes the injection a lot more comfortable. Buffering in anaesthesia also does decrease pain. So I use sodium bicarbonate to buffer my anaesthetic solution before I'm injected into the patient. A simple way to decrease pain is talkesthesia. Distract the patient. It actually works. If you've got a dead silent room and nothing happening around you, then the patient's going to be very focused on this needle going into their skin. If you have some music playing in the background, if you're having a conversation with the patient about what they're up to, that can help distract them, and it actually does make the injections less painful. So another concern for patients is the pain after the surgery. And my advice there is always ice. It's really useful using cold water, ice packs, to decrease the swelling of a wound, but also it's a very effective pain relief. It can be more effective than paracetamol or opiate drugs. So encourage the use of ice packs and give them written instructions about how to use it. My normal suggestion is about 10 to 15 minutes every 2 to 3 hours for the first 48 hours after surgery whilst they're awake. I don't want them to wake up at 3 in the morning to apply ice packs, but obviously if they do wake up at 3 in the morning, applying ice that time is quite useful. It's normally only the first 48 hours that they require this. After that time, most wounds are quite comfortable.